in Jersey to understand the emotional, social, environmental and economic challenges they may face. And also, we were keen on finding out not just about people with disability, but about carers as well, so the prevalence profile and experience of carers. So just a very brief bit on the methodologies of how the research was carried out. It was a self-completion survey, and it was done both by postal and online methods. So households were initially sent a postal survey, but if they wanted to, they could choose to complete that on a website and go online. The methodology was we selected 1 in 4 households in Jersey randomly to participate, and that equated to almost just over 10,000 private households, which is a pretty large sample, and it's a similar way that research is done with the Jersey Annual Social Survey. The response rate that we received was 42%, which is a good response rate for those who don't know. What it means is that the research and the statistics that we've got were statistically significant, and that we have a confidence level of, I'm going to write this down, here, 99%, plus or minus 1.9%. So basically any of the figures that we have, we can be confident that within roughly 2% more or less they are representative of the population of Jersey as a whole. Now, one of the things to say from the outset is the challenge of defining and measuring disability, and this is something that is not unique to Jersey. It is a worldwide issue that people are still grappling with today. So the research that we have been doing is conducted with the UN social definition of disability in mind, as opposed to the medical model. There is, as I was saying, there's no kind of one agreed measure of what disability is in the world. So what we decided to do was actually use 2 different measures. One was the UK Office National Statistics measure for disability, which is based on the Equality Act definition of disability, which is, and again I wrote this down so I don't muddle it up, a physical or mental health condition or illness lasting or expected to last 12 months or more, which impacts on their ability to carry out day-to-day activities a little or not. And then the other measure that we used was the UN measure of disability, which is about functional impairments across 10 different areas. So that's about memory and concentration, sight, mobility, social, hearing, learning, problem solving, dexterity, communication, and self-care. And that is about how the individual has functional impairments, but how that interacts with the environment within which they live. So that's definitely the kind of social definition of disability. When it comes to prevalence, I've popped up this slide here which looks at both of those definitions. So 14% of all individuals from the survey, which equates to almost 14,000 residents, have a disability as defined under the UK Equality Act, which in terms of households equates to almost 11,000. And then when we're looking at the UN measure, the functional impairments, of those residents that have at least one functional impairment, that's 35% of residents, which would equate to 34,700, which is in fact 66% of all households. And just to put that into context of a couple of other places, in Jersey we have a figure of 14%. In England, slightly higher at 16.8%, and in Guernsey, the figure is 21%. The things to point out is that the way in which the questions were asked is slightly different in all of these places. And the format, so some were postal surveys, but in the UK, for example, there were people going out and asking these questions face to face. However, that aside, there's still probably some reasons for the difference, just based in the difference in the social makeup of these different places. So what the results tell us, that in terms of people who are most likely to be disabled, have an impairment or a diagnosed health condition, are older, on low incomes, live in social housing, not in work, and live alone. And what we've got up there the percentages you see of the respondents. I can talk through those if you want me to. There's a lot of numbers, so if anyone wants any more depth, let me know. Otherwise, I think the best thing to do is after this, not only will I send you these slides, but I'll make sure that John sends through the link to the full report on the survey, which is quite a chunky beast. But it does have an executive summary which kind of highlights the key facts and figures for you. Yes?
In those percentages there is any distinction between what the impairment is? It's just that X% of old people are impairments.
Yeah, this is at the kind of total level, so then we delve down, so the report delves down in the differences between the functional impairments, and this is of anybody who responded yes to having either a functional impairment or have a disability as defined by the Equality Act. Moving on to what people with disabilities said about their health. As it says there, roughly people with disability are 3 times more likely to say their health is good. So the top bar is people, and again this is going with the UK Equality Act definition of disability. As you see, 7% of people say their health is very good, 25% say it's good, and the rest is of an average or bad nature. So 48% of people with a disability, which is the largest proportions, consider their health to be fair. Comparing that to people who responded to the survey who do not have a disability, 44% say their health is very good, and 47% consider their health to be good. So in total, that's 91% of people without a disability say their health is at least good, with only 32% of people with a disability.